Well, good morning. I'm Mayor Tom Barrett, and I am delighted to be here this morning on a gorgeous Friday morning. And I want to thank all the people who are so patiently waiting in line. We've tried to arrange good weather for you, so we hope that you enjoy your wait. It will not be an extended wait. We really appreciate the fact that you're all here. The reason all these people are here this morning is just moments ago we opened doors to the first of our 13th annual Back to School Health Fairs. But before I begin, I want to give a special thanks to Bishop Daniels, who is here today, for welcoming us to Mother Catherine Daniels Conference Center for the first time this year. And Bishop Daniels, as many of you know, is a long time. Not only is he a great spiritual leader, but he's a great community leader as well, and is so engaged with the young people here in the northern part of the city of Milwaukee that we are very appreciative of that. I would also like to thank all of our 2013 sponsors, BMO Harris Bank, the United Way of Greater Milwaukee in partnership with Children's Hospital of Wisconsin, the Milwaukee Urban League, and Molina Healthcare, along with Children's Community Health Plan and Community Connect Health Plan. Without the generous support of these sponsors, we would not be able to serve the more than 4,000 individuals we expect to welcome to our two health fairs. I would also like to thank the entire staff of the City of Milwaukee Health Department for the months, and I mean literally months of planning that go into these events. For the past 13 years, our annual Back to School Health Fairs have been an essential part of ensuring that our entire community is ready for a healthy school year. It has been a concerted effort to achieve the 86% compliance rate with the MPS that we see today. This is a great achievement, not just for the children who receive their immunizations, but for our entire community. Because a healthy child means a healthier classroom, and a healthier classroom is a place where all our children can learn, grow, and achieve success both in the classroom and ultimately out in the community. That's why we're doing this. But beyond vaccinations, those who take part in these health fairs also have access to vision, dental, and hearing screening, as well as lead tests and general health checkups. And thanks to our sponsors, we are able to provide every child with an up-to-date immunization record with a backpack and school supplies. This is all about helping our next generation start the school year off healthy and ready to learn. But before I turn it over to our sponsors, I would like to urge those in the community whose children need access to these services to stop by our health fair today, obviously, and Friday, August 16th from 10 a.m. to 3 p.m. at South Division High School on Lapham Boulevard. Now I would like to introduce Kara Kaiser, Regional President at BMO Harris Bank. Kara, thank you for coming.
Thank you. Thank you, Mayor Barrett. And hello, everyone. My name is Kara Kaiser, and I serve as Regional President for BMO Harris Bank, and it's my absolute pleasure to be here with you today. BMO has sponsored this event for the past 2 years because we understand the importance of a strong and healthy community, and we know that this starts with our children. Myself, as a mother to 3 young children, I can tell you there is nothing more important than their health. Nothing. So to have an event like this where families can come together in one place and get all the health services that they need, I think is just fantastic. And as Mayor Barrett said, to top it all off, everybody gets a backpack with some much needed school supplies in it. I applaud the Health Department and Mayor Barrett for holding this event year after year. And I applaud all the parents who have come out today to help prepare their children for the school year. BMO Harris is proud to support the community, and we're proud to support the 2003 Back to School Health Fair. Thank you very much, and I'll turn it back over to the Mayor.
Thank you very much, Karen. And again, thank you to BMO for being such a great sponsor. I'd now like to introduce, although I don't think she cares to speak, Nicole Angrisano from the United Way, and we want to thank you for your support, Nicole, and thank you for being here today. Next, I'd like to call up Ralph Holman, who is the President and CEO of Milwaukee Urban League. Ralph?
Well, good morning.
Good morning.
What a wonderful, beautiful day. To Mayor Barrett and to Bishop Daniels and to all of our wonderful partners. The Milwaukee Urban League is very pleased to join with everyone as we try to prepare our young people for this new school year. You know, unfortunately, In many of our central city neighborhoods, we have high unemployment, high levels of poverty, and some families with no access or limited access to health care. At the Urban League, we see the negative impacts that these conditions have on individuals, families, and especially our children's quality of life. You know, in today's competitive global society, we feel that one of the best ways to overcome these negative conditions is by having a good, high-quality education. And we know that in order to be successful in school, young people need to be healthy. You know, it's very difficult to concentrate on the schoolwork, as the mayor said earlier, if you have vision or dental problems. It's also difficult to concentrate if you're not feeling well because you've not been screened or immunized for many of the illnesses that are very preventable. So therefore, this morning, I say to all of our parents and caregivers, as you prepare for the new school year, yes, it's important to get those new school clothes. And yes, it's important to get those new shoes and sneakers. But it is more important to get new health care checkups for your young people. And this is why our back to school health fair is such a critically important service that enhances the quality of life for everyone throughout our community. Thank you.
Thank you very much, Ralph, and thank you for your great leadership throughout the community. Finally, I would like to introduce Scott Johnson, the Plant President for Molina Healthcare of Wisconsin. And again, thanks to Scott and Molina for helping out again this year.
Well, good morning, everyone.
Good morning.
Is everyone ready for a great event? I'd like to thank the City of Milwaukee Health Department for the opportunity to speak with you today. We at Molina Healthcare are so privileged to be able to serve more than 95,000 Wisconsinites. Molina is a family-run, mission-driven company, and we know that access to health care and navigating the healthcare system can just be overwhelming. That's why we partner with our members and our families in their healthcare journey to provide the best services and care we possibly can. We deeply value our partnerships with the community, faith-based and other organizations throughout Milwaukee and the state, and of course our providers. The City of Milwaukee Health Department has been a great partner with us and has supported us with many of our events by bringing education about healthcare services to people. We thank them for their partnership and continued support. At Molina, through our dedicated community outreach team, we offer free programs to organizations and people throughout the state of Wisconsin and nationwide. These programs and events provide education about access to health-related services. As we approach 2014, we are at a pivotal point in our country's history. In 2014, we will have access to affordable health care, and we at Molina are excited about the opportunity to provide health coverage options to an additional 47 million Americans who are currently uninsured. In 2014, everyone will have access to preventive services such as well child checks, annual checkups, pap smears, prostate screenings, and several other services at no cost. Access to health care is key, and we strive to ensure that our members have access to the services they need when they need them.
All of you for being here. I also want to introduce two representatives from our Milwaukee Health Department who are behind me, Jomar Hooper and Dr. Eric Gass, who are joining us here this morning as well. So we have other individuals from our health department. Again, a special thanks to all of them also. Is there any questions? We're happy to answer any questions.
You mentioned an 86% compliance rate?
Yes, we have made this a priority since I became mayor in 2004 to raise that rate because we were so far behind the state average. We've been bringing it consistently over the last 9 years.
What does it mean for the having 14% not in compliance, what does it mean for those who are in terms of their health and their risk?
Well, I'll let Dr. Gass talk about that. Doctor?
Good morning, Eric Goss, City of Milwaukee Health Department. The goal is to get as many people immunized as possible to achieve what we call herd immunity in the community. It is an issue, but there are a large number of people that choose to take waivers for personal reasons or religious reasons, and so there is a plateau in the community. 86% is the best rate that we've seen in many years, and so we're still trying to get up higher to 94, 95, 96%. But from where we were a few short years ago, 86% is a drastic increase.
Great start. Is there, by opting out of it, is there a risk to others?
I'd say there's always a risk, but having 86% of the people immunized will ensure that at least that many people will not get the disease.
Sure.
We're pleased with the progress that we've made, and up to this point, we'll continue to go higher, but 86% is an excellent number.